Hello and welcome to my home. My name is Olivia Ash and I am a compliance consultant with Compliance Dashboard. We at Compliance Dashboard want to say we are right there with you. We are working from home for you during this unprecedented global pandemic that we are dealing with. We wanted to send you this video to let you know you're not alone. We've been working on your behalf and we have resources available for you, and we will continue to provide the service you have come to expect from Compliance Dashboard. We're here to create simple, easy to understand educational materials about regulatory changes. So in the next few minutes, I am going to overview the information that you received in the email. There are several links and documents that you can use and send out to whomever you need it. So this video, this email is targeted for everyone, for advisors, brokers, and employers, because we know right now things have been tossed up in the air and we have to figure out what to do with these regulatory changes that have been passed in an amazing amount of time. That's our job and we are working for you. So let me start by saying, everybody just take a deep breath and let's focus on what the legal changes are, and I'm going to run down the information. Please know that I don't have enough time in this video to go through every detail, and also that this is not legal advice. This is educational information, and the most important thing you can do from an employment perspective is talk to your legal counsel, take a look at your business, take a look at your policy documents, and focus on your employees. But we've got your back and we're here for you. This video has three major sections. So I'm going to first off talk about this regulation and this regulatory information that we received in the last 11 days. I'm then going to talk about how that applies and the things that you should consider as an employer regarding benefit plan compliance. And then we're just going to talk about some practical considerations and we'll get you on your way. Again, please feel free to use this information as you need and to forward it to those who you feel it could be beneficial. So first things first, you now have access to a Geek Out page on Compliance Dashboard that's entitled Coronavirus Regulations and Benefit Plan Considerations. I'm going to run down the information in that Geek Out page, but please reference it and send it out to whomever you need to send it out to. So first things first, what is the Families First Coronavirus Response Act? Well, that act was signed into law March 18th, 2020. And basically its aim is to reduce the economic strain from dealing with this global pandemic. It modifies several existing regulations, and I will discuss those, including FMLA expansion, emergency paid sick leave, and tax relief, among others. We have a great blog summarizing the Families First Act, so please make sure to check that out. The link is included. And remember, as of April 1st, employers are required to distribute an FFCRA, the Families First Act, notice. And the links for the notice posters are also in the information that you have been given. We also have a fantastic resource of state websites. So we have another Geek Out page, and the link is in the information, for coronavirus resources by state, also including some U.S. federal agencies and international websites. So please check that out if you have any questions. It's a great first place to start. So what are some compliance considerations regarding the Families First Coronavirus Response Act? Well, first things first, mandated coverage. This is effective March 18th. All group health plans, including grandfathered and health insurance issuers, must provide coverage for COVID-19 diagnostic testing and related services without cost sharing. So that's very, very important to understand. This coverage must include services that are furnished during in-person or telehealth visits, urgent care visits, or ER visits. The IRS Notice 2020-15 also permits group health plans to cover both testing and treatment on a first dollar basis without affecting participants' eligibility and an HSA. A second major pillar of the FFCRA is Expanded Family Medical Leave Act. So this is effective April 1, and this is big. So now the Family Medical Leave Act now permits an eligible employee for 12 weeks of leave if the employee is unable to work or telework due to need to leave to care for a minor child. And a minor child is defined as such: a son or daughter under 18, if it's a son or daughter of the employee, if the school, whether it's elementary or secondary, or that place of care has been closed, or the child care provider or son or daughter is unavailable due to a public health emergency. That's a lot and it's a mouthful, so please check out the information on the Geek Out page to review that and really let it sink in. FMLA definitions have been modified temporarily to help employees and help employers manage this time off and these quarantines and working from home, if possible. Now, an eligible employee now means someone who's been employed for at least 30 days, which is quite different than the existing legislation. An employer now applies to employers with fewer than 500 employees, including those with fewer than 50. Schools and public agencies are considered employees for these expanded requirements. And then, of course, public health emergency means an emergency respecting COVID-19 as declared by a federal, state, or local authority. There are some additional provisions that I won't go over, but it's very important to read those and understand those and what qualifies as an eligible employee, an eligible employer, a public health emergency, and know who a minor child is. Now, a second major prong of the FFCRA, emergency paid sick leave. So now employers with fewer than 500 employees and public agencies, regardless of the size, must make 80 hours of paid sick leave available for full-time employees unable to work or telework. Part-time employees are entitled to paid sick leave at the regular rate of pay for the average number of hours that that employee works in a 2-week period. Please consult our blog summarizing this information. It's very good. There are several reasons the employees who are unable to work for that emergency paid sick leave, there's several reasons, there's 6 of them, including they're experiencing symptoms of COVID-19 and seeking a diagnosis, they're caring for a son or daughter, or they're subject to an isolation or quarantine order. Those are only 3 of the 6. Again, please take a look at our blog and the information in this email. Last, regarding the Families First Act, tax credits. Okay, so the act includes tax credit relief for employers who are required to make these payments regarding that expanded FMLA and paid sick leave provisions. So now there are, of course, limits, but employers are entitled to a refundable tax credit equal to 100% of expanded FMLA wages paid by an employer on a quarterly basis with a cap amount. Please check out the information to see that cap amount. So with the rest of this video, what are some benefit plan compliance considerations? The ADA. Okay, the ADA exists so that an employer cannot ask disability-related questions. However, in this situation, employers may ask such employees if they're experiencing symptoms of the pandemic virus. However, the employer must continue to keep confidential medical records. Cafeteria plans. Now, most insurance companies are offering new special enrollment windows. There's still some information unclear as to permissions for electing coverage and how that works on open enrollment. So stay tuned, but please read this notice for more information. COBRA. Employers need to be aware of when a qualifying event may occur as a result of reduction in hours. So qualifying event notices may need to be sent. So take a close look at that information and make that determination with your counsel. Regarding ERISA plans. So remember, mandatory coverage. Plans must provide coverage, no cost coverage of COVID-19 testing and treatment. Don't forget your benefit plan documents, employers. Plans must update their summary of material modifications, summary of benefits and coverage, and summary plan description. And those have to be provided within 30 days of an employee's request. Don't forget to review electronic disclosure rules, especially with most everyone working from home or telework. And then employees requesting a copy of the SBC must receive it within 7 days of that request. Now, election change rules have not been altered. Let's talk about essential health benefits. Self-funded plans and those in the large group market are not required to offer those. However, if they do, they cannot impose, of course, annual and lifetime limits on those benefits and have to apply the plan's annual out-of-pocket max to them. Now, Health and Human Services released a frequently asked questions about essential health benefits and COVID-19, which you can access via the link in this information. Now, employers may not ask employees if a family member has tested positive for COVID because that is a violation of GINA. Okay, so GINA, we have to think about GINA, the Genetic Information Non-Discrimination Act. However, if that employee volunteers family medical information, there's no violation per se. Nonetheless, employers need to be practical and be cautious in seeking follow-up questions for an inadvertent disclosure. What about FSAs? So health flexible savings accounts. Section 125 permits pre-tax payroll contributions, and these tax contributions are earmarked for special expenditures. So just remember what qualified medical expenses are. Now, health savings accounts with high deductible health plans. I mentioned IRS Notice 2020-15. It does permit HDHPs to cover testing for and treatment of on a first dollar basis. HIPAA, Health Insurance Portability and Accountability Act. Don't forget HIPAA privacy and security during this time. It does apply to remote workers. So rules are still active and they're in place for covered entities. So generally, covered entities are prohibited from disclosing PHI without a patient's authorization. Now, something to consider. Protected health information that is provided, so it is created, received, maintained, or transmitted by the plan, is protected. PHI that is voluntarily offered by an employee is not protected health information. Now, review HIPAA rules and regulations regarding disclosure exceptions, because right now we're in a public health emergency, so some of those public health authorities and government exceptions will apply. Last, remember, any disclosures must be minimum necessary to accomplish the intended purpose. Short-term disability. If employees don't have enough sick leave to cover their days off from work due to a mandatory illness or quarantine, prepare a response to use to talk to those employees. Consider optional policy expansion, so emergency paid sick leave, work from home policies. In general, it's a good idea to take a look at all of your employment policies when it comes to paid sick leave, time off, and being flexible in the workforce. We're all in this together, and it's really important to understand the Department of Labor has set a temporary 30-day non-enforcement period since March 18th from the Families First Act for employers who have made reasonable good faith efforts to comply with the Act's provisions. So that's a non-enforcement grace period of 30 days from March 18th. Now, they will enforce thereafter. Please consult your advisors and counsels to understand these contents and how it's going to affect your workplace. So remember, mandated coverage provisions are effective March 18th. They were effective 11 days ago. And then remember that the remaining provisions of the Families First Act are effective April 1st, and they do sunset December 31st of 2020. So let me wrap up here. First of all, thank you for watching. I do hope that this has been beneficial, and we, again, at Compliance Dashboard are here to help you understand and make things more simple. Let's end with some practical tips. And I said this before, to just breathe and stop and take a moment. That would be my health teacher background coming out, is to really step back and take perspective. And let's not forget, in the hurry and the rush to understand the regulations, we need to think about our employees. We need to think about our policies in place. We need to think about being creative on helping families to work as they need to work and be productive as you're able to provide that to them during this time of uncertainty. Know the law, so consult counsel and check the laws frequently. Check our dashboard frequently. We're going to keep providing information and blog posts as we see necessary and helpful to you to help you with guiding your employees about how these changes affect benefit plan compliance. Take care of yourself, okay? And check for regulatory updates, including CDC changes, and make sure to consider the option of following the CDC's guidance on keeping the work environment clean, especially if you have an essential service right now and you have employees coming into the office. Do your best to follow those CDC guidelines. That is a reliable source on ensuring that you as an employer are providing a safe work environment. So once again, thank you for your time. We at Compliance Dashboard wish you well, and we will talk to you again soon.